Mr. Bhatia, a husband and father of four, met with a motorcycle accident in early 2018, where he was rendered unconscious as he hit his head on the tarmac and had suffered internal bleeding. He suffered from paralysis on the left side of his body and injuries to his right leg and was unable to eat or breathe properly, nor was he able to remember or focus as well as prior to the accident that changed his life. He also struggled to regain his speech and walking ability post-accident. Mr. Bhatia was in the ICU and had a tracheostomy, a surgically created hole in the windpipe which provides an alternative airway for breathing, and was in a vegetative state where he needed to have a nasogastric tube inserted to allow feedings through the nose. When he was finally able to be discharged from the hospital, he went home in a wheelchair where no rehabilitation exercises were done. Having endured his struggle for 4 months, he finally sought help from Region Rehab Hospital, and through a series of rehabilitation therapies in an intensive 1-month program, Mr. Bhatia was able to walk with assistance in the 3rd week of his therapy at Region. Not only that, Mr. Bhatia also regained some of his physical functions and also some quality of life. Alright, welcome back. This is Health Matters with me, Dishen, Kumar, and today's topic is traumatic brain injury or TBI, and I'm at the Region Rehabilitation Hospital here in Petaling Jaya, and today with me is Dr. Kavitha. Thank you, Dr. Kavitha, for joining us today.
Thank you for having me, Dishen.
Okay, so let's start off with, I know everybody has this question, what is traumatic brain injury?
Well, traumatic brain injury is when someone has a blow to the brain from an external force, and this basically causes, it can be temporary or permanent brain damage because of that force that they had, commonly seen after motor vehicle accidents. And because of the injury, this leaves the person with impairments such as weakness, problems with their thinking, behavior, memory, and that really is what traumatic brain injury is.
Now, talking about the blow to the head, how bad or how heavy should be the blow to the head, or how severe?
Yeah, you know, it can vary. For example, an older person who has a fall, which we may think is trivial, but because they already have some shrinkage in their brains, which does affect the blood vessels, they would have a bleed much easier with what we would consider a trivial fall, whereas maybe someone younger may need a harder impact. Actual force, I can't tell you, but
yeah, exactly, I understand. But the interesting part is if usually when you have a fall and there's impact to your brain, if there's bleeding, is there traumatic brain injury, or there are signs or symptoms or things that you can actually test out?
If there is trauma, then and which causes bleeding, then that is traumatic brain injury. Sometimes it's not obvious bleeding, what we call like a concussion. You may not really see anything even on a scan, but that is still considered traumatic brain injury. So traumatic brain injury has a spectrum from mild to severe traumatic brain injury.
So if you can't really see it on a scan, then
you would look at symptoms.
Okay.
So they would have things like, even someone who is dazed after a blow to the head would, if you're dazed for a certain period of time, then that is considered mild traumatic brain injury already. If you've got some amount of, you've forgotten parts of the event, those are all symptoms of traumatic brain injury.
But isn't that something like, they say, isn't that a concussion?
A concussion is traumatic brain injury. It's in the part of mild traumatic brain injury.
Oh wow, okay. So usually people ask, is it much different from stroke and things like that?
So a stroke is what we call an acquired brain injury. So you're right, it is a form of brain injury, but it's not due to trauma. The symptoms can be the same. Many of the symptoms are the same. Like, for example, they may have that typical weakness on one side of the body, problems with talking, problems with swallowing. So a stroke and a traumatic brain injury patient can have similarities like that, but there are usually differences as well. We find that people with traumatic brain injury have more difficulties with things like multitasking, executive functioning, probably more difficulties going back to work. They have more problems with changes in personality and behavior. So there are differences as well.
So if there's, let's say there's a person who enters the hospital with a blow to their head and things like that, what are the signs that actually you look at, or do you immediately say, since there's a blow to the head, there's a very high chance of it being a traumatic brain injury, or is there, let's see how the patient reacts and things like that, and then you treat based on
Yeah, so this is usually done in the acute hospital, not so much a rehab hospital, but when they go in, so the doctors will look at certain parameters, for example, what we call a Glasgow Coma Scale, their ability to obey instructions, whether they're confused or whether they're drowsy. So they usually have cut-offs where they sort of say, okay, this needs a CT scan straight away. Whereas someone who's had a blow to their head, otherwise well, you would probably say, okay, let's watch you in hospital for a while. And then usually they are discharged home. If they're well during that period of time that they're watched in hospital, then they're discharged home with instructions of, if any of these things should happen, then you come back to hospital straight away.
Oh, okay. So not every time that immediately you know that the person actually has traumatic brain. Sometimes it takes some time after some monitoring and things like that.
You would know based on the symptoms. If they came in and said, I had a blow to the head, and or I had an accident and I don't remember what really happened, or someone says, oh, they were quite drowsy initially, but now they're okay, you would know that they've probably had some amount of mild traumatic brain injury, but it's okay to watch and wait. There's no active intervention that needs to be done at that point.
Now, talking about the mild and severe, that whole range, can you give us examples of severe traumatic brain injury?
So a severe traumatic brain injury is someone who is probably not conscious when they come into the acute setting. Even when they do regain consciousness, they may be confused for sometimes more than a week. Sometimes you see patients 2 weeks after the injury, they still do not know what day it is, what time it is, where they are. Sometimes they don't recognize family members, even though they're able to have their eyes open, they're able to eat when you give them food, but yet they're not really aware and alert of their surroundings. So those are all suggestive symptoms of severe brain injury. If they have a bleed, if you do a CT scan and there is a bleed, then it isn't mild anymore. It could be anything between a complicated mild to a severe brain injury, depending on the bleed.
Okay, and talking about the patients, how is it for a patient to have traumatic brain injury? Can they lead a quality life after that?
So it depends on the severity of the injury. It depends on which area of the brain was affected. So someone with, or most people with mild traumatic brain injury on the whole recover completely. Most of them do. Whereas those with moderate and severe traumatic brain injury have got a higher chance of being left with a residual deficit, which could be some amount of weakness or some amount of problems with their memory. Now, of course, with rehabilitation, everyone can improve to a certain extent, but how much they improve is very dependent on the severity of the injury in the first place and the area of the brain that was affected.
So it's a case by case?
It is very individualized, yes.
Okay. Talking about rehab and the treatments that you guys offer, if a patient comes in, what are the first things that you guys say that, okay, this is what we need to handle first before moving on to anything else? Or is it still a patient by patient?
Okay. While there will be similarities, the program has to be individualized, because we say whether it's a stroke or traumatic brain injury, no two patients are the same. So we always start with a full assessment, and the assessment is a physical assessment. We have to look at the medical background of the patient as well. We are looking at how well the patient is currently functioning, and very importantly is to look at the social status of the patient, because things like social support, the more support a patient has, the better the outcome they get. And so all of this has to be looked into before we can sort of say, okay, this is how your program is going to be. The other thing that we do in rehab medicine is we set goals. We find that if you just work on everything at the same time, the patients don't do as well and they get a bit frustrated. Whereas if you pick specific goals, like we would say, okay, for you, my goal is the goal that, and of course the patient has to agree with the goal. Our goal is going to be to improve your gait so that you're walking better. And for patient A, it may mean that we want to do more strengthening because the problem is actually in terms of power. With patient B, we may find that it's not really power, but it's your problems with balance that's affecting your gait. So depending on what is affecting the gait, we tailor the program to address those issues. Sometimes we need to use aids to help the patient. Like if you saw Injure, he had a carbon fiber AFO, and that has really helped him improve his gait by clearing the ground. It also helps him with energy expenditure when he walks. So those are important things to know when you need to use the right aid for the right problem.
And for people who come in, patients, you were talking about support. Now, how important is that support? Does it really help the patient, or is it really as important as because Mr. Bhakti was talking about how important his family was to him, you know, being there for him and things like that. How important is that?
Very, very important. Patients with good family support are more motivated. They, I guess, having the better support system helps them to just overcome the emotional hurdles better. So it's difficult trying to be independent when you have a disability, and having someone to train with you at home is really important. When we finish the inpatient program and patients go home, the rehabilitation doesn't stop there. We need to make sure that whatever they've learned in the hospital is carried over at home. And when they have the support, people who have learned, who have come into the hospital with them and learned what to do and able to help them at home without doing everything for them, that's when you see the most improvements.
Now, for patients with disability, one of the most common issues is depression.
Yes.
How does a rehabilitation hospital handle that?
Yes, depression is common in people with disabilities. So we have a psychologist who comes in to help us with that. Sometimes we start them on a low dose of an antidepressant if needed. We have a visiting psychiatrist if needed. And the thing about rehabilitation is that it is never one discipline managing everything. It has to be an interdisciplinary program. And so depending on the disabilities of the patient, the medical condition of the patient, we have different team members. So we've got a neurologist, we've got a psychiatrist, a psychologist, we've got our physiotherapist, occupational therapist, speech therapist, and each one comes in depending on what difficulties the patient has. To help the patient achieve the same goal. So we're all working towards the same goal, but each one doing different things.
Okay. Now, one of the most important questions that everybody's going to ask watching this is, how much does rehabilitation cost?
Okay.
So that's one of the biggest questions. Everybody watching at home should be asking this question. So, how much does the rehabilitation program cost?
Well, that's the problem with rehabilitation because it's so individualized. So some people may need less therapy, maybe more medical care. Some people may need more therapy, very little medical care per se. And so in a rehabilitation hospital, you know, if you have an infection, that's antibiotics, the cost goes up. If you're otherwise medically stable, then the cost is much lower. So I can't give you a ballpark figure because it's very individualized. But we do want as many people to benefit from rehabilitation as possible. So we have our community social responsibility program, which is called our Wish Upon a Star program, and we will be running it again this year, where we invite anyone who has a disability or who knows someone with a disability to just make a wish, and what we will do is try and choose as many as we can to get rehabilitation, either free or a very discounted rate here at Region Rehabilitation.
How can they contact you for this event? So
usually our marketing team will put out, it'll be on Facebook, it'll be on the media, and all they have to do is to make a wish on our Facebook page.
So let's move on into the rehabilitation situation in Malaysia, because even for me personally, we don't really hear a lot of rehabilitation hospitals and things like that. So how is that a challenge for hospital like Regen to try to change the mentality, because a lot of people think rehabilitation is something like a nursing home and things like that. So what are the challenges you guys actually faced?
So we have had many patients come in and be pleasantly surprised. Initially, I think what the feedback that we get is their thoughts were, this is a nursing home. Rehabilitation is like maybe a glorified nursing home. And then having come in and done the program, they have really understood the difference. Our aim is to get them as independent as possible, to optimize their quality of life as much as possible, and wherever possible to get them home so that they can be as independent as possible. Versus a nursing home which is maybe more extended care in a facility. So we are very different that way. The program can be quite demanding. We have been called boot camp by some of our patients.
Wow, okay.
Torture chamber.
Is that a good thing or is that a bad thing?
It's a good thing because they understand the need for, when they have learned to do something, the nurses no longer do it for them in the ward. The nurses supervise and support, but their role is to get the patients to do it by themselves. Even though it may take 20 minutes to put on a shirt, we still want you to do it by yourself, because that's the only way you're going to get better at it. And so sometimes, you know, it can be a little bit frustrating. But
how strict are your nurses?
Well, I guess each nurse is different.
To be called a boot camp, I think they're pretty strict.
They understand that rehab nursing is very different from acute nursing. In an acute ward, there's so much going on. The nurse wants to get the job done as quickly as possible. So we've got patients who, after traumatic brain injury, when they're still not so aware of their surroundings, if you put food in front of them, they don't eat. But if you scoop food in a spoon and put the spoon in their hand, they've got that automatic behavior of bringing it to their mouth. So the nurse, yes, it would be so much easier and faster for the nurse to just feed them, but they're not allowed to do that.
Do it by themselves.
So they need to scoop the food, put the spoon in the patient's hand, and let the patient finish the meal. So if the patient can do 50%, they support them on the 50%. And so rehab nursing is very different from acute nursing. But that's the way it has to be.
Okay, all right. Let's move on into lifestyle changes. Okay, now if somebody has traumatic brain injury, like you said, mild or severe, their life will change. We were talking about that earlier. But what exactly, what are the types of lifestyle changes that they have to make in order to adapt to having this new life, as per se?
Okay. We've got maybe two groups of patients. There will be a group of patient that doesn't have the insight, you know, which means they are not able to understand that they have a deficit, they have a problem, maybe a problem with their thinking or a problem with their memory. Those are the ones that are probably more challenging, and that's when you really need that family support to sort of cue them and help them along. Then there are those that have the insight, they understand that these are their difficulties. You know, they may be physically well, but they may know that they have problems with memories. And so things like keeping a journal, things like if there are problems with multitasking, things like breaking down an activity into 3 or 4 steps rather than trying to tackle it as a whole. So we teach them these different methods of doing things depending on their disability, and also their ability to make those changes. So if the patients can't make the changes on their own, then we teach the family members how to help them make the changes. So there will always be changes that they need to make in their lifestyle, but all depending on what the problem is.
Okay. Moving on, maybe we can talk about for doctors now, traumatic brain injury, is it something that all doctors are kind of aware of, or what is the current awareness in Malaysia about traumatic brain injury? Because even for me, I don't know it's a blow to the head, maybe your brain is bleeding, there's internal bleeding and things like that, but that word, that whole diagnosis of traumatic brain injury, is there do a lot of people know about it as such in the medical line and also like in the society?
Okay. In the medical line, things have improved quite significantly over the number of years that I've been practicing. I've seen the change. We've also got more neurosurgeons out there, more maybe psychiatrists and people who are also interested in the field of traumatic brain injury. So there has been a big change from a within the medical profession. More doctors are also understanding that there is a need for traumatic brain injury rehabilitation, and we definitely get more support from these doctors. However, maybe within the public sector, there still isn't a very good understanding on traumatic brain injury. We have patients who are physically well, but they have got problems with multitasking, executive functioning, and they go back to work. And because they look normal, it's difficult for people at work to understand why they just seem a bit slow. You know, their thinking's a little bit slow. Their reactions are slow.
But there is a change there, right after that.
There is a change, you know, but sometimes in the community, you may just feel that that person's being difficult, or sometimes they have apathy. They know they need to do something, but it's difficult to get the motivation to get the job done, and so they start having problems with their colleagues at work. They start having problems with bosses at work, and that's why we really try to step in to educate people at work as well, that these are their difficulties, and to help them cope, these are the areas that they need help with.
All right. Thank you so much, Dr. Kavita, for your time.
Thank you very much.